What health and social care do you want? That's the question we at Llais have been asking the people of Wales. As the independent body that reflects the voices and represents the interests of people in Wales, we want to know what works, what doesn't, and what needs to change so that we can help create fairer and more balanced health and social care services for everyone. I'm Alyson Thomas, Chief Executive of Llais, and today we're talking about our project, the Health and Social Care We Want, with Noreen Blanluet. Hello, we're here today to talk about all things public engagement in Wales, and I'm very pleased to welcome Noreen Blanluet. Noreen, would you like to introduce yourself?
Thanks, Alyson. I have several hats, but I guess what's relevant is I co-founded the Co-Production Network for Wales and was director for several years. And I am now a freelance consultant working in the areas of co-production and involvement, as well as more broadly engagement, relational working, teamwork, healthy cultures. Basically, how do we show up and work together, especially in kind of complex environments where decisions are difficult and things are changing. But how do we work well together, whether it's partnership working or hearing the voices of the people that we're looking to support? All of that.
So health and social care services talk all the time about engaging with the people and the communities that they serve and developing designing services with them. Tell me a little bit more about what meaningful engagement looks like with people and communities.
I kind of want to think about a bit about definitions about what we mean when we talk about engagement, because actually sort of like the everyday use of the word engagement is just, there's an interaction. But if we're thinking about it in terms of public services context or in kind of policy context, it means quite specific things. And so we could think of engagement as just any interaction that we have, as a service with the people that we support or with our citizens. But it could go from anything to, protecting people or educating people all the way to kind of full co-production and having people at the, being part of the decisions that shape their lives and everything in between. And sometimes when we say engagement, we mean all of it. But I think that when we're talking about engagement in health and social care, we're thinking more about how do we involve people in the decisions that support that. So leaning more towards the co-production and involvement side, but not always necessarily, because actually we need that kind of spectrum of different ways of interacting with people. Even though I'm, very strong advocate for co-production, and I think it's very important. I never say you have to do co-production with everybody for everything all the time, because it should be part of your toolkit. But actually, for some, so if you're trying to write policy, you're making kind of national decisions. We're not going to involve 3 million Welsh people into decision making. We need to be able to make decisions that work for everybody. And so it might be kind of more research or participation or kind of making sure that we have the representation and the insights to make wise decisions with a subset of people that then work for everybody else, are likely to work for everybody else. So I think meaningful engagement is choosing the right level of what kind of conversations, how involved do we need and want people to be in order to really inform our work. And it's also finding who are the people that we absolutely need to have the conversations with. If we kind of some of this maybe old-fashioned or kind of traditional ways of doing consultation and engagement is putting a call out from a kind of a public service perspective, saying this is our agenda, this is the question we want to see answered. Who wants to tell us something about it? And the people who self-select or who are tuned into these kinds of questions are a certain profile of people who are tuned into public policy or to public consultations and who have something, who work in the sector. And are we hearing the voices of people who are not in those networks? And so if we want to do meaningful engagement, we've got to go beyond that and really think about who are the voices that we never hear? Who are the people who are going to be most affected by the decisions we're making? And where do we find them to go and have conversations with them? That's the first round. And then I'd say on top of that is like, why should they trust us? Why should they talk to us? How do we show up? How do we build the relationship and the trust with them in order to have the conversations that are meaningful for them and not extractive and feel like it makes a difference, as well as informing our work and enabling us to make wise decisions.
So we talk about being inclusive in Llais quite a lot because we've got a significant responsibility to make sure that we aren't just at Llais responding to those who shout the loudest and can advocate for themselves, but absolutely to find how we can reach and hear from people who are underrepresented. How would you advise us to go about that in the best ways?
I'd say the ultimate aim is expanding your expanding your networks, building the relationships with these underrepresented voices. And I love that you said underrepresented as opposed to hard to reach, which is sometimes used as a term for people who don't come into these conversations a lot. And actually the problem isn't that they are hard to reach, is we're not finding them, we're not kind of drawing them into the conversation. So I really appreciate how you phrase that. But we don't know who we don't know. If we don't have an existing relationship, then why should they talk to us? And so I'd say the place to start, which I know you're already doing, is who are the trusted partners? Who are the organizations or groups that people have in their lives that they're already in relationship with? I talk about relationships so much because this underpins all these interactions. So the relationships, the trust, the kind of respect and the empathy that we have for people, that's what enables us to have these conversations. And so if somebody, take my neighbor, who's kind of an older man who lives on his own and who may or may not have some additional support needs. Sometimes I worry about him, and I'm thinking, but he doesn't have a relationship with Llais, for example. But who does he have a relationship with? Who does he see? What groups is he involved in? Who might be able to draw him into a conversation or nearly advocate for Llais, saying, did you know that Llais exists? And they could help with this, actually. So trusted partners, community groups, other organizations, whether they're statutory, community, third sector. I think maybe from a comms and PR perspective, it would be very hard for Llais to make itself known to 3 million Welsh people, to be, as known as, I don't know, the BBC or ITV Wales, or I don't know why I'm thinking just media, but, organizations that everybody knows about. But actually, people don't necessarily know, they don't necessarily need to know about Llais in general, but they need to know about Llais when that support would be relevant for them. And so having somebody who knows what Llais does and how you can help and be able to say, being able to be in this conversation. So if my neighbor was, at the local, I don't know, bridge club or whatever he does, if somebody was picking up something or he was just chatting about like, oh, this happened and this wasn't great and I really struggled with this, or actually this was really good, which is also the nice conversations to record. If somebody's tuned in and goes, do you know who you could tell about this? Llais would be really interested in that. I think you should should we kind of make that connection? I think those are those trusted partners, those kind of advocates that would enable you to really reach into communities, especially the less represented, the underserved communities.
So that's about us being really active and visible in communities. Definitely. Through our people on a day-to-day basis, so that we can both understand those communities and then build those relationships and maintain them. Because I know that kind of we've talked to some people who have been really clear that they're fed up of public sector coming to talk to them when they want to know something, take away the information, and then they don't hear what happens to that again, and people won't keep doing that. So I think it's really important that we kind of have that conversation that goes round and is circular. So we ask for information, we use it, we let people know what we've done as a result of it and what difference it makes, and then hopefully they'll come back round and talk to us in much more of a continuous conversation.
Absolutely.
Can I extend that out a little bit in terms of health and social care services themselves? Because it's what we want at Llais is those kind of meaningful conversations and that listening to take place directly by health and social care services. But we also know that there's a significant power imbalance when somebody needs health and social care services between those providing the service and those who need the services. How can services overcome that power imbalance and create that equal relationship?
I'm not sure we can create an equal relationship if there is a power imbalance, but acknowledging it and working with it, and I think being honest about it, saying as maybe as a medical professional there is stuff that I can do that you can't do, but also as the patient or as the person accessing services, there is stuff that you know that you can do that I can't do for you. And so there is some, sort of organizational power or hierarchical power or, expert power. This kind of dynamics happen. But it's also saying it's not everything. It's not just that. This is not the only dimension we're working in. We're not just, I'm telling you what to do and you have to go away and do it. It's how can we build a conversation, acknowledge that this exists. I'm here because I bring in expertise, but also you have you have control over your life, or you should have, and then have agency. And actually, I'm ready to listen. That's the thing that comes up so often in conversations. We've got to really listen to people and what their lives might look like, and have different kinds of conversations. And so kind of like, I guess the short answer to how can health and social care services do it is kind of change how they think about the relationship they have with the people they're supporting. Yes, they have a responsibility to bring the training, their expertise, their knowledge, their resources, being able to prescribe, being able to signpost, all of that kind of stuff. That's part of their role, but also they need to really listen, and often listen first, because that changes the dynamics. I was reading something the other day, which is a doctor changing the conversation. Somebody came in with something that looked like early dementia with their daughter, who is kind of providing a lot of the kind of unpaid caring support. And he thought, oh, well, my training is going right. Probably this. These are the tests we could do. These are the kind of the referrals. This is the process that we can dive into. But he paused and said, before I kind of jump into that, I'll be like, how are you doing? And said to the daughter, she's really lucky to have you supporting her. How are you finding it? And that opened a different conversation, and it enabled the mother and daughter to have a chat about what was difficult and what was working for them, but also kind of how they were doing it together, and a completely different vibe. I was trying not to use the word vibe, but I have now. But, different dynamic to the conversation, saying, I see what you're bringing. I see your life. I might only see a little bit of it because I'm with you for like 10, 15 minutes. But I'm seeing that, as opposed to just seeing a diagnosis or seeing a referral pathway or seeing it. And that humanity, that's what builds relationships.
That plays through really strongly in terms of what we've heard through our Health and Social Care We Want project, because for an awful lot of people, what they're asking for is to be seen as a person, and for services to understand what matters most to them. Yeah. So if we shift the start of the conversation to who somebody is and what's important to them, then actually that can frame the conversation about their care, treatment, or support in the right way, and it does create that power balance and that space for shared decision making, doesn't it?
Absolutely.
Great. Thank you. That's really helpful. We've talked a little bit about how people who need to access services and services can work together in partnership to help make the best decisions for people. I'd like to broaden it out a little now, if I may, to talk about doing that on a community basis, and particularly to inform and influence how services are designed in a way that works for communities. We sometimes see at Llais examples of when that goes wrong, when the conversations have not been gelling together between those who want to change the services and those who are receiving services. So I'd like to get your views as to how that can go well in communities. How would you advise health and social care services to can build that relationship and that community engagement?
It's kind of big and kind of simple at the same time. It's one of those kind of paradoxical things where it takes work and commitment, but once it starts happening, it really works. But that setting up, I guess, is key. When you're able to have those very person-centered relationship conversations with the people accessing services, when that trust is building, then I think the next step, which is hard to achieve in isolation, but if you can build from a personal and individual conversation, then maybe you can invite people into, this isn't just about your treatment or your care plan, but this is about you and people like you, or your community, or, a group of patients who have the same, I don't know, condition, or living with the same, whatever it is. And kind of broadening the conversation with them, saying, and not everybody will be interested. People are busy, and especially if people are dealing with, the reasons why they're accessing support. People's lives are complex and sometimes chaotic, and they may or may not have the capacity. But the invitation to saying, you understand what it's like to not just live with whatever it is, but also access our services. And we're trying to improve, and we'd like to have your views on like what could have worked better, or what could we do differently that would change things, or what was sticky, and those kind of informal conversation. It doesn't have to be like, come into a consultation about, and making it super bureaucratic and formal. It's just like, is there anything we could do different? What worked for you and what didn't work for you? So keeping it, I won't say simple, but keeping it nearly casual, as in like, this is a normal conversation to have. It doesn't have to be like an over-engineered come into a focus group conversation. Is, by the way, how is this going for you? And if you have things to say, can we like carry on the conversation, and kind of, this isn't just about your provision now, but it's like, how can you help us improve? Because we really want to see of you. You know this better than anyone. And what I wanted to add to that as well is, not everybody will have the same capacity or the same time, or it will vary over time. Sometimes life goes busy, sometimes you got a bit more availability to engage in these kinds of things. And so engagement can't be one size fits all. It can't just be, everybody has to come to this one meeting, which is during business hours because that suits us, on our premises because that suits us. But we've got to have different ways to have these conversations with people, even if it is, what we were saying earlier about at the end of, a chat or a consultation or whatever, saying, how are you finding it? Is there anything else anything you want to tell us? Or we're looking to, improve our service. Can we have a follow-up conversation with you? Engagement is like everybody's business. It's important to have like an engagement team, and people can really support and advise and drive this. But just because there's an engagement team doesn't mean it's like, it's just those guys and everybody else can do business as usual. Is we should all be interested in what it means for people's lives. And having these different ways of like informal conversations, formal conversations, being able to dip in, dip out. Maybe you just want to send us an email when you have time at like midnight when you can't sleep or something. Or maybe you want to come in and talk to us. Maybe we can ring you. Or having these different avenues that are flexible and responsive to people's contexts and lives and the complexities of what they're going through. That's really important. It's also kind of showing people what happens about, because we were saying earlier about how, if we're extractive and we keep saying, tell us what we want to know, and then it will get, often not deliberately, but it gets kind of put into this machinery of the organization and the systems and the strategic decisions and all this process, which takes time. And then the person who fed in is just like, nothing happened with that. It might be happening, but it's invisible, or it might be happening slowly because processes. There's lots of different reasons. But the person doesn't hear it back. It's like, we just keep feeding this stuff in, and it just goes into a black hole and nothing changes. And so we need to, we're saying earlier about building these continuous conversations, continuous engagement. It's like, we're not being the bad friend who only gets in touch when they want something. It's like, we're in relationship here, and so we're making sure we're showing up for them as much as they're showing up for us, and we keep updating them. And if we're saying it's going to take 6 months to make this decision, but we will get back to you, maybe at 3 months, it's like, we haven't forgotten, we're still working on it. We haven't left you dangling, but this is how we're working. And there's partly that conversation needs to people understanding how organizations work a bit. Because as a patient or as a service user, all that stuff is invisible. We see the frontline professional, we see the face of the organization, and we don't have no idea what happens behind the scenes. And we're like, well, I told you that like 6 months ago, why hasn't anything changed? It's like, well, let me tell you all the stuff that needs to happen in order for this to change. And maybe some of that process needs to change too. But, that mutual understanding is not just as us as organizations understanding people's lives. Part of the relationship is people understanding how the organizations are supporting them and how the process happens behind the scenes.
What part do you see Llais playing in that?
I would say kind of advocacy, good practice, encouraging and supporting and kind of really steering people towards, this is what good engagement looks like. This is how you do it. This is how to think about it, and kind of validating, cheerleading, but also kind of suggesting, that could maybe have been improved if, we did this, and kind of nearly being the advocate on both sides. So you're kind of advocating on behalf of people to kind of escalate, this is what's not working, and this is how, going to organizations and saying, these things are sticky, how can we help you improve this? But also the conversation saying, we're here to kind of help you understand, be in relationship. In a way, you're nearly like a relationship broker. But the relationship is, goes through the engagement, building those connections and those conversations and that reciprocal understanding.
Yeah, because we've seen some of the most successful relationships are actually when organisations are honest enough to say that they've got something wrong and they've made a mistake, and they want to work with that community to kind of put it right. Because I think the people that we hear from recognise that health and social care services are fundamentally delivered by people, and that they turn up to actually do the best they can for people. Yeah. Sometimes that gets a bit wrong in the mix through process. So the conversation can help deal with some of those challenges that will happen, I think, on a day-to-day basis.
And you're going to be, because of the nature of who you are and what you're doing as an organization, you're probably going to hear more of the when things go wrong than, the success stories and let's send a compliment. And those are the situations where, understandably, through human nature as well as sort of like kind of PR and organizations are very nervous to say we got it wrong, we've made a mistake, I don't know, press, lawsuits, etc. There's threats looming if an organization says we made a mistake. There can be all sorts of like really negative consequences, and I think that holds people in we're not going to admit to anything, but we'll do some work in the background. But actually, you can't do as good work in the background without really understanding what went wrong. And people might have good ideas about, or might identify a different kind of problem that you're identifying internally. Are we even looking at the right thing? Are we asking the right questions? And so if we can have that honesty and have the conversation saying, we've realized that we're not doing well with this, or we've made a mistake, or, but we want it to not happen again, that builds a lot of respect. And that's treating people with dignity as well, with the acknowledgement that their story, their experience and their story matters, and we want to do something with it. And it can lead to very difficult conversations in terms of, this is how much hurt we're carrying. And so if we're going to do good engagement, we have to be prepared to deal with these hard conversations and be able to hold them skillfully. And it's not personal, but we need our space to debrief and have our peer support. As professionals who do engagement, we have to be able to hold that for people. But we have to be able to hear and not be defensive and be like, and allow that, because difficult conversations aren't difficult forever unless we're not listening. And people have to keep repeating the message, this went wrong. But if we can open the conversation, yes, it did. And we hear what happened to you, and we really want it to not happen again. Will you work with us to change things? And it might take time, and it might take this, and we'll help you understand, what the constraints we're under as organizations. We really want you to be part of this because we think we can do a lot better. That's a different kind of conversation that's got a lot more respect and a lot more dignity in it than you stay over there and we'll try and solve things behind, and you may or may not see something happening.
Yeah. Sometimes we hear from services where they struggle because not everybody can get what they want, and what everybody wants from their health and social care services is the same. What tips would you give them as to how they deal with that when they have communities with different views and different solutions to how services should be designed and delivered?
I think that's the bit when we were talking right at the beginning about the different kinds of engagement, and some of them is very co-produced, people being part of decision making and just really equal partners with professionals in terms of decisions, implementation, all of it. But we also need kind of people's input, but make decisions for like a greater number. And it's not going to be perfect for everybody. And that clarity, that honesty, setting the parameters of like, this is the conversation, from the outside is like, this is what we're doing. This is why we really want you to be involved. This is what it might look like. And we're, looking to make a decision for the greatest number. that will work for as many people as possible. And so it could be, it could be that some of the stuff we can't do because it's out of our remit, somebody else can do. So can we work with partners? Can we work with third sector organizations? Can we, somebody else might be able to provide the solution that we can't, that people are wishing for. It might be that people see that, because it's open and reciprocal conversation, that they're seeing what kind of decisions we're making, and people are reasonable. If you give them enough information to make an informed decision and really grasp the broader context, people will make decisions that benefit the majority. It shows up time and time again. They might start the conversation with like, no, what do I get out of it? And then understand the broader context and go, oh no, I'm actually leaning towards a different decision now because I can see how it would benefit, like the broader community would benefit other people. And that, I think we forget that. We think everybody's out for themselves, but we're not.
So we've talked about the different ways in which we can engage with people in ways that works for them, recognizing that everybody's got their own individual needs. So we need to have a kind of a package of different approaches. How can that play out as well in terms of playing back to people what's happened as a result? Because we often have and see an awful lot of effort being put in to the listening phase. And then once a decision is made, it tends to go quiet, and we don't keep that conversation going in communities about the effect of that decision in terms of how services are delivered, which bits are working, maybe which bits need tweaking. What tips would you give both Llais to keep involved in that conversation, but also services to make sure that they continue that conversation with their communities?
I think maybe the one and only tip is like keep track of people. Obviously with your permission to contact them, have those conversations, but like, can we update you? And people might be like, no, I'm done. I've said my piece. It's fine. That's all I want. It's like, okay, but that's fine. But probably most people be like, yeah, go on, let me know when something's, and so having that not losing track of people, not going, like you said, oh, we've done the listening now, it's fine. Now we're moving into a different phase with a different contact sheet or whatever. But it's making sure we keep in touch. And it could be, having engagement teams embedded in organizations is such a gift, because actually it's hard, although engagement is everybody's business, it's hard for, literally everybody to be like, oh, pick up the phone. And also, who else is everybody kind of contacting the same person to say, oh, by the way, the thing you said? So having some kind of systems and coordination around it is obviously important, but making sure that we keep in touch, we update people, we drop them a line, we see them, we pop into the group that, maybe we went into the Bridge Club on the Tuesday evening in this community to chat to people. And maybe we'll pop in again in 6 months saying, do you remember me? We had all these conversations 6 months ago. This is the stuff that I just wanted to let you know this happened. And taking the time to keep in touch, it can feel, when you're kind of busy in an organization and there's all this and you have to do more engagement and more this and more conversation, it can feel like, oh my God, I haven't got time to go back to these conversations we've already had.
We hear that all the time.
Right?
Yeah.
But that investment of time in what enables you to have the ongoing relationship and have more conversations when you need them, because otherwise you'll lose people and they'll never want to talk to you again because they're like, oh, just falling into the black hole. So that's not how you build a relationship. You've got to keep in touch. And it doesn't have to be a lot. It hasn't, but it's treating people like people, not treating people like data points, not treating people like sources of information. Like, if that was me, if this was my mum, if this was my uncle, that somebody'd come in and said, we'd like to hear what you think about this. And then they just were left hanging. How would I feel? How would they feel? It's like, let's not do that. And it's not rocket science. Like, engagement isn't rocket science. It's like, how are we good people with people? But somehow, we do it with our neighbors. We do it with our friends. We build relationships in our communities. We support our family members. But somehow you put a professional hat on and suddenly we're like, we're on behalf of this organization, or we're like participation team, or we're something. And we forget how to be people with other humans. And we just need to remember that.
Thank you. We talked a little earlier about language and terminology, and there's a lot of it in health and social care services. But you talked about engagement and you've touched on co-production. Can you describe for me what the difference between engagement and co-production is?
Yes. So engagement, I would say, is the broader spectrum of any kind of interaction, but maybe more specifically having conversations with an end in mind. So, how do we support you, or how do we improve our service? How do we make decisions that will have an impact for you? But in the broader sense, it can be, we know what questions we want to ask. So we're going to come and ask the questions, and then thank you for your answers. We're going to take them away and put them with everybody else's answers, and we'll have a good think about it, and we'll design something. And we'll basically do it for you. And there's nothing wrong with that. That's important in some places. For some of the things we need to do, we need to gather information. We need to hear people in the different views. And then we need to make a decision as an organization that's going to work for the majority. I will come back to that in a second and thinking about designing for the margins. But, we need to make a decision for the greater number. Whereas co-production, it can lead to making decisions for the greater number, but it starts with very personal conversations about, what matters to you and what does a good life look like, or, how does a good service work, and enabling people to go beyond that, to carry on the conversation into what are the bits you can help us decide? What are the bits that you can play an active role? And so you won't be applicable to everybody. If you're setting up a new, strategic group for something, as a service user, I don't really care if you're setting up a strategic group as long as you do stuff that matters. But if you're setting up, maybe a peer support group, or, you're setting up something where my voice can have a direct impact, or will make a real immediate difference, then yes, I want to be part of that. And maybe I have a role to play because the fact that I'm there makes a difference to other people. And so co-production is doing with. It's that we professionals and members of the public have important information to the other party. So both sides of the knowledge matters, that lived experience as well as the professional experience. But we make decisions together. We design stuff together. We design solutions together that we might not have thought of if we only had one side of the lens. And then we see, who does what and how do we implement it together. Whereas sometimes we need to do for people a bit more. And so it's more, we have questions, or we'd like to hear what you think, but we'll take it away and we'll do something with it. Sometimes this is more appropriate. Sometimes co-production is more appropriate.
And that's why it's really important, isn't it, that services are clear with people about the level of influence that they do have, so that it's a part of a deal then, isn't it? And people are clear about the boundaries.
Setting expectations, definitely.
Yeah, absolutely. Okay.
Can I just quickly come back to that thought that I'm going to lose otherwise? When we're designing for, if we're doing for example, if we, whether it's like a strategy or policy or something that needs to serve the greater number, we, depending on the greatness of the number, we might not be able to co-produce every detail of it with everybody whose life is going to be affected by it. So it's leaning more into kind of participation or consultation, or maybe user research, or we're going to want to make sure that the stuff we're designing will work for as many people as possible, hopefully everyone. And so their representation really, really matters. And coming back to what we were saying earlier about the people who self-select to come and feed back into these conversations, they won't represent everybody. Where are the underrepresented voices? Where are the people who are usually not present in these conversations? Because often, and this is broad strokes, but often the more vulnerable people struggle to access services, people who need more support or need more of a voice, are the people who don't come in and who wouldn't have that voice in the way our existing systems are set up. So we need to go and seek them out and really make sure that we represent those voices, all of those minoritized, underrepresented voices. And there's a concept in service design and I guess product design around designing for the minority. Because if we make sure that the most vulnerable people are part of the conversation and have their needs met with what we're designing, whether we're doing for, we're taking it away and designing, or whether we're designing it together, then it will work for the majority. And so just taking, Wales is 90% this and 90% that, and as long as we've got the 90% represented, it's good enough. It's like, no, because actually the 10% will fall through the cracks. And so we must make sure that we hear those voices, Because if those more complex, more needs that needs more support are met, then it'll be fine for the others who have different needs or lower levels of needs.
And that takes us not only to the way services are designed, but designing the engagement methods
Yes,
as well.
absolutely.
So it is about thinking not only the different tools that we might use, the different places we might go, but also the space that we create for people to feel safe,
Yeah.
to share what's important to them in their language and in the way that works for them.
Definitely. And in their spaces. And we need to be, as organizations, as people doing engagement, we need to kind of balance. We want to hear from as many people as possible, and nearly it's a numbers game. We want to make sure that we've covered all the voices, and at the same time, having a cup of tea with one person also matters, because you get a depth of conversation and insight that you don't get when you're doing, the broad spectrum. And so you need both. You need the deep conversations, which will be smaller numbers by necessity because of time and resourcing and the quality of the relationship that it takes. And we need to balance both. And often as organizations, it feels that as long as we've done a survey and we've reached thousands of people, then we've got it covered. But it's not enough. We need to balance it with, okay, well, where do we drill down to really understand where it will make a significant difference to complement it? So I'm not saying do just cups of tea with deep conversations, because you'll worry about like, who have we missed?
Yes.
So you need the broad picture,
Yeah.
but then also drilling down, you need to balance both.
Thank you. So if I was to narrow this down then and ask you to summarize overall what we've talked about today, what would be your top 3 tips for Llais or for health and social care services around good engagement?
I think my first one would be, it's not first what we do, it's how we think about it. That would be my fundamental. It's about building relationships. It's about really listening. It's about thinking about people as people. How do we come in with respect? How do we come in and build a relationship where people have agency, they have dignity? We're not coming in with our agenda, but we're coming in with humility and a willingness to listen. And that's hard. Sometimes we're in patterns of organizations where we're the experts and we have a particular role to play in that we've been playing throughout career, and kind of shifting that dynamic, saying, oh, I'll pause before I send somebody down a dementia referral path. I'll stop and acknowledge that, them and their daughter are dealing with this right now, and I'll listen to what their experience is. It's possible, but it takes conscious effort. So we need to think about it. And the other thing is engagement. That relationship building is everybody's business. Yes, we need engagement teams. Yes, we need people who can support and advise and enable the rest of the organization. But it's not just them who do engagement. It's everybody is having these human-to-human conversations, ideally, and feeding the insights in. It could be, anecdotal evidence, but you gather enough anecdotal evidence and you have a data set.
How do we get services to achieve that when they're under so much pressure and they're so busy? Having a conversation about creating the right relationship can be quite difficult when they've got lots of people waiting far too long to get the service they need. How can we crack that?
Oh, I wish I knew. I wish I had a magic wand. I think it's willingness. And not everybody will get on board immediately at the same time. And, there are some people who may be resistant to it, and eventually they'll retire. But what we've been seeing is, newer generations, more recently kind of trained and qualified, medical professionals, social care people, that's built in more into their training, into their professional kind of development and their way of looking at things. So, we can't change everybody's mind overnight, but there are people who are already doing it. How can we find that, highlighted those bright spots? They're doing it even though they're under pressure and everybody's on long waiting lists and everything's really difficult right now. but that practice exists. So how can we celebrate it and show the impact it's having and the difference it's making to people?
I think that's really important, because I think we see that on a community level. If you actually invest the time to do the listening well up front and then continue that actually saves so much time for services further down the line. And I think there's something about for Llais kind of putting a spotlight on that where it works, understanding what's made something work and then sharing that to encourage it to be spread out. So I think it's an investment of resources to save resources in the longer term.
I totally agree. Yeah. I think my third point would be, and this is where Llais have a really key role, I think, is people need to have permission to do it. So that it's generalized. There's probably a bunch of people out there doing it without permission, but they're doing it because it's the right thing, but they're doing it nearly despite the system they're working in.
Yeah.
But actually, if the system, the hierarchy, the decision making, the policy, the strategy, that's enabling their work or kind of framing their work, if that's explicit in terms of we listen, we support, those values and these ways of showing up, that commitment and that permission to do it from leadership, and embodied as well, is the leadership listening to their workforce so that the workforce can listen to the people they support. The culture needs to run through all the levels. Just because somebody is in a strategic role and they don't have the day-to-day frontline conversations doesn't mean they don't have a role to play in setting that culture and setting those ways of working. So permission is a big one, I think, that commitment. And it can be, people think, it takes time and it takes resources and then it takes money, and it doesn't have to take money. It definitely takes time and it takes commitment. It takes energy. In terms of resourcing, I guess it takes energy, and it takes not forgetting to do it, keeping it in mind at all times. But it doesn't have to take money. I recently had a conversation with a senior nurse who's just completely transformed the dementia referral and diagnostic pathway, working over about 6 to 8 months, completely cost neutral. But the user experience as a result is transformed, and the relationships that she built with the different teams of clinicians, the social, everybody, is what made the difference. And she took the time and she had the support and she was encouraged to go and figure it out and do the transformation work.
Yeah.
But it didn't cost anything extra. It took her time and the fact that she was committed to it in her work. So it is possible.
Noreen, thank you so much for joining us today. I'm really grateful to you. Thank you.
Thank you. Thanks for the opportunity.
Thanks so much for watching and listening to episode 3 of the Health and Social Care We Want. Llais is always looking to hear your views and experiences of using health and social care services across Wales. And you can find out more about how you can join the conversation by visiting our website at www.llaiswales.org or following us on social media.